My name is Dr. Kahlon. I'm one of the medical directors at Central Jersey Urgent Care at Somerset location, New Jersey. I just wanted to go over some information about COVID with you today. Now, I know that with this pandemic, there's been a lot of information that's out there. However, I just wanted to go over some of the symptoms that you may be experiencing if you do have COVID, as well as to discuss with you about asymptomatic carriers. Some individuals don't get symptoms at all. These are individuals who are asymptomatic at presentation. Some individuals never get any form of symptoms and they may transmit to others, which is why contact tracing as well as quarantining after exposure still remains the recommended guideline. Some individuals may be asymptomatic for a period of time, as we do know that this disease process may take several days before individuals actually develop. So the asymptomatic period may actually be a pre-symptomatic period of which people may develop symptoms shortly afterwards. And the spectrum of the disease process is very wide, very vast. Some individuals don't develop anything at all, others develop a more severe disease process. Many people after exposure tend to develop symptoms around 5 to 7 days, but the range is between 2 to 14 days, which is why, especially after exposure, quarantining still remains the recommended guideline. Now with adults, some of the most common symptoms tend to be fever, body aches, chills, headache, cough, sore throat. You can have digestional symptoms as well, such as diarrhea, nausea, vomiting, and as others also know, loss of taste and smell. Now, this is not a comprehensive list of all the symptoms that are there. Those tend to be the most common ones. Some symptoms that are more severe that may require hospital evaluation can be discoloration of the lips, a bluish color, severe shortness of breath, which I will get into in a minute, and severe fatigue. Now, those are things that may require a hospital evaluation, but not everybody requires them. Severe shortness of breath, it's difficult to fully categorize, but certain things that you may want to pay attention to are if you're not able to complete a sentence without taking a deep breath in, or if activities of daily living, such as cooking or walking normally, become very, very limited. Children can have different symptoms. Children from the ages of 0 to 9 can have very similar symptoms, but they may not explain everything appropriately. So, cough, fever, fatigue, headache, sore throat. They may have digestional problems as well. And the loss of taste and smell may be hard to categorize, especially in the younger age group. Children in the age group of between 10 to 19 exhibit similar symptoms with cough, fever, body aches, sometimes stuffy nose, headaches, shortness of breath, nausea, vomiting, and diarrhea, as well as they may be able to explain the loss of taste and smell. In children, we worry about cutaneous causes, meaning a severe rash or a severe change or a discoloration in their tongue. Those are reasons why you may want to consider a hospital, along with shortness of breath, similar that you may see with children if they're having a difficulty performing their normal tasks, or if they're having retractions, or where you can see the rib cage showing when they're taking a deep breath in, along with not able to complete a sentence without taking a deep breath. Those are indications for a more detailed evaluation at the hospital. I appreciate you guys checking in. I hope this information was valuable to you. We do have more information available on our blog and on our Facebook web pages as well. Okay? Hope you have a wonderful day and stay safe.